Welcome to Innovations in Clinical Implementation, the Ovation Lab and A4M series where we translate emerging science into clinical strategies you can bring directly into your practice. We're here live at Longevity Fest 2025, exploring the root causes of male longevity, vascular aging, and sexual health. I'm Andie Crosby, partner at Ovation Lab and president of Calroy Health Sciences. In today's podcast, I'll be joined by Dr. Miles Spar, a leading authority and educator on men's health and personalized performance medicine, and Dr. Christy Adamo, a noted epidemiologist with expertise in the relationship between modifiable lifestyle factors and human health across lifespan. Dr. Adamo is also my partner at Ovation Lab, leading our clinical research initiatives. Today, we're gathering to talk about innovations in clinical approaches using nitric oxide as an exciting new tool for male sexual function. We're going to be talking about a study that Calroy Health Sciences recently did with Vasconox HP. Aspects of this study have been presented this weekend at A4M in multiple sessions by both of our guests today. We've gathered quite a few questions from attendees that I'm excited to discuss with you. Welcome, Dr. Spar and Dr. Adamo.
Thank you. Good to be here.
Yeah. So nitric oxide we know is a hot topic and a hot topic this weekend, but I think we should just start with the basics. What is it?
Right.
Why does it matter? And how does it connect to longevity?
Sure. Yeah, it is certainly one of the trending, having a moment compounds of the body. So nitric oxide we might think about as something that dilates blood vessels, and that's what it does. It's kind of like a gasotransmitter. So it's a gas, and so it's very short acting in the body, but it helps to dilate blood vessels, especially if you're exercising a lot and you need more blood flow, let's say to muscles or to the heart, then the body will actually trigger production of nitric oxide to dilate blood vessels to allow more blood flow. But like everything in the body, it's always more complex in a good way. It's more elegant in that nitric oxide actually has a lot of other properties. So it has a lot of beneficial properties as well in the brain and pretty much every tissue of the body. But let's start with that it is important in dilating blood vessels.
Wonderful. And then how does that connect to male sexual function,
Sure.
for instance?
Well, we all know that first of all, we all know that in order to get an erection, you need blood flow, right? And so the number one cause of erectile dysfunction are deficiencies in blood flow. Certainly, there are other issues with erectile dysfunction. It can be related to low testosterone, to psychological issues, to stress, performance anxiety, a lot of things. But still, by and large, the majority of the causes of ED at any level is blood flow coming down and not getting that sufficient blood flow for a good erection.
Now, in this particular formulation, Vasconox HP, that we used in this study, this formulation includes precursors for both nitric oxide and hydrogen sulfide. So that's a very unique approach. What is the significance of providing a multi-pathway approach rather than just focusing solely on nitric oxide as most nutraceuticals or even pharmaceuticals do?
Yeah.
What is hydrogen sulfide?
Yeah, exactly. So, well, first of all, there have been nitric oxide supplements for a long time, for years, that raise nitric oxide and can cause vasodilation, but they're very short acting and they're not very convenient to take and they don't help for a very long period of time. So that's been the challenge. Then came along this understanding that, well, there's a buddy for nitric oxide called hydrogen sulfide, another gasotransmitter, so to speak. We think of it as something that actually causes problems in the gut. And so a lot of our listeners might be familiar with hydrogen sulfide being associated with SIBO and intestinal bacterial overgrowth. That's because if you have too much of that in the wrong place, you have symptoms. But like everything in the body, you have to have the right amount in the right place to have the beneficial effects. And what was found that hydrogen sulfide actually works synergistically with nitric oxide. And what's most exciting is the way nitric oxide, and it's getting a little chemical here, but the way nitric oxide causes vasodilation is by creating something called cyclic GMP. So it's a conversion of other substances to cyclic GMP that stimulates that relaxation of the walls of the blood vessel so they dilate. But that goes away pretty quickly. The cyclic GMP gets removed from the body by something that might ring a bell called phosphodiesterase PDE5. So some of your listeners might be thinking, PDE5, I've heard about that.
Yeah.
Right. So people take PDE5 inhibitors to block that removal of cyclic GMP. And those PDE5 inhibitors are Cialis and Viagra and things like that. They work well because they keep that cyclic GMP level high enough to keep the dilation dilation of the blood flow going, and that the dilation of the blood vessel going to allow for more blood flow. Well, it turns out hydrogen sulfide is a natural PD5 inhibitor. It does other things in addition with nitric oxide and synergistically with that, but that's one big role that it plays in this supplement in Vasconox, is that it helps that nitric oxide last longer in a way that we never could do before.
And how do we know that it does last longer?
Right, from studies. So studies looking at a few different things, looking at kind of, and Chris is an expert in this, what's like the first thing you're trying to do, you're just trying to raise nitric oxide level. So studies that looked at, did nitric oxide level go up? Yes. Does it stay up? That's the difference. Lots of studies have shown it goes up with a nitric oxide supplement, especially one that uses nitrates or nitrates. But then when you added hydrogen sulfide to this compound, to the Vasconox, we saw that NO, the nitric oxide level, went up and stayed up for a full day. So it's only having to be taken once a day instead of the level plummeting after 3, 4, 5 hours. It stays up for 24 hours. And even at 24 hours, it was already at a higher level than it had been the 24 hours before. So day after day, that level, that baseline level kept going up. So then you look at, okay, so nitric oxide went up by testing it in the mouth or whatever. Did that have an effect? Well, there's actually a study showing blood pressure came down, which is directly related to nitric oxide levels going up. If the blood vessel's dilating, the blood pressure goes down. So that shows you that not only did the NO go up, the nitric oxide go up in those measures, but it had a real impact on a secondary outcome measure.
Right. So that first study actually really showed longevity of effect, which is critical if you're going for, you don't need it if you're using nitric oxide for a workout, but if you're using it for something like decreasing blood pressure or
sexual function.
Whenever you want it.
Right. Not having to just have something that only works for an hour. That's,
exactly.
Yeah, it's going to be stressful.
Yeah. So let's go to the next study. So Chris, you were very involved in the development of the next study. So can you tell us a little bit about this sexual function study and how it was set up?
Yeah, happy to. So it was a randomized placebo-controlled trial, which is the gold standard, in our field. And not just that, it was a very large study. It's about 600 participants in the study, and it looked over 6 weeks. So to Miles's point, this is not a very short-term outcome we're looking at. We're looking at how does this go over a sustained period of time. And after the 6 weeks, the Vasconox product was statistically significantly superior to the placebo in erectile function and orgasm ability. So this is pretty impressive. You get a large, kind of gold standard study like that to demonstrate these effects. Have
we seen this in the supplement industry?
It's the largest one to date by a pretty wide distance, actually. So it's great to see studies of this magnitude. Yeah, just to kind of demonstrate that these products do have real effects with this kind of rigorous scientific approach.
We're really excited about it. And I think the other thing that was interesting in that study is that the placebo group actually had more side effects. So how would you explain that?
That's actually researchers debate that still. Like there's this thing called nocebo effect. I think, there are some expectation effects that, supplements that support male sexual health are going to have side effects. So, but I think anytime that there's more in the placebo group than in the active, in this case, Vasconox, that demonstrates that this is a safe product that's essentially devoid of side effects. There weren't many side effects in either group, but the fact that there were more in placebo than in Vasconox was a really interesting and impressive finding.
Maybe it just points to the overall health benefits of vasodilation and better blood flow.
Right.
Exactly.
Who knows?
Or nitric oxide, like I said, it has all these other effects all over the body,
right?
In addition to the blood flow.
Right. So that's a pretty exciting finding. I have a question. We're really focusing on male physiology, and the study was on men. Is there any conclusions that we could draw or suppose related to women's sexual function? I know would be great to have a study on it.
Right. No, we need a study. Well, blood flow is important for women's sexual function as well, especially for lubrication, for having turgid tissue to be stimulated in that area, and for the clitoris to get blood flow. That's all important for sexual function and orgasm function. So yes, we need a study for sure, but it makes sense that there would be a similar effect.
Yeah. Well, I'm all for adding more research money into women's health. So hopefully we'll get there. So Dr. Spar, this study mentions that hydrogen sulfide, which we talked about, that hydrogen sulfide donors may help non-responders to PDE5 inhibitors. So can you expand on why some men don't respond to PDE5 inhibitors, and how this hydrogen sulfide nitric oxide combo might be more beneficial?
Sure. Well, so it gets a little complicated. So get a little sciencey, but if somebody has very poor health of the lining of their blood vessels, it kind of doesn't matter how much of the PDE5 inhibitors you're going to give them. They're not even making the raw materials like the nitric oxide to have an effect. And the reason is in that lining of blood vessels, we make something called eNOS, endothelial nitric oxide synthase. It makes sense, synthesizes nitric oxide in the endothelium, the lining of the blood vessels. Well, if somebody is having poor metabolic health, if they are having high blood sugars, they have hypertension, any risk factor for heart disease is a risk factor for poor endothelial health. And that means not only do we just think of that as causing plaque, it actually makes that lining not work well. And the lining isn't just an inert tube lining, it's a lining that's very active in having substances that are actually antioxidants and promoting nitric oxide. So if you have a poor health of your endothelium because of metabolic health, weight issues, blood pressure issues, you can take all the PDE5 inhibitors you want, but you're not making much nitric oxide because you don't have that endothelial nitric oxide synthase to even start that process of the cyclic GMP happening. Does that make sense?
So in a weird way, it's kind of like trying to fill a bathtub with the drain open.
Yeah, exactly.
It'll work too.
Let's get upstream. Yeah. And by the way, you get other benefits too if we work upstream and we work on blood pressure and blood sugar and all those other things.
We could all benefit from a healthier cardiovascular system.
Yeah. So this is much more treating kind of the root cause issue by bringing in both. So the hydrogen sulfide is doing the work of the PDE5 inhibitor, but the nitric oxide support is really helping that endothelial nitric oxide synthase do its thing.
Great.
Yeah.
Well, as someone who treats men's health issues and is considered an expert educator and leading clinician in that area, what type of patients do you think could benefit from this intervention, this nitric oxide, hydrogen sulfide combo in Vasconox?
So there are lots of uses from cardiovascular disease, but from a sexual health standpoint, where I've been using it, honestly, is I have quite a few patients who take a low-dose PDE5 inhibitor on a daily basis. Mostly, it's prescribed for at a dose that's used for benign prostatic hypertrophy, but really it's for feeling a little randy all the time at any time. And just, it's not that therapeutic dose for ED, but it's a dose that helps. And many of them, I've been able to switch off of that onto Vasconox. And so they're getting the cardiovascular benefits of Vasconox that you don't get from the PDE5 inhibitor, and they're getting the same exact sexual function benefit that they got from that low-dose PDE5. Right. And they've even told me that sometimes I didn't tell them that. I gave them the Vasconox for cardiovascular disease, and they'd be like, I'm waking up noticing some, anyway, you get my point? And so, can we say morning wood on the podcast?
Yes, we can. We can.
And actually that's why I was not surprised when I saw these study findings. I'm like, I'm hearing this from my patients all the time.
Yeah. I joke with my colleagues all the time that if my 20-year-old self knew that my current self would be talking to all my colleagues about their erections, I would not have believed it. But yeah. So I think as we're getting ready to wrap up, but Chris, I want to ask you one more question. You've really long advocated for and been a really active voice and participant in really increasing the evidence base for the dietary supplement industry and encouraging supplement companies to invest in research. So looking forward, you're on our Science and Medical Advisory Board. So we would ask you, where do we go from here? Where are the interesting places for Calroy to be thinking about, where to take this particular study? And then just in general, we talk to you a lot about the research that we're planning, as a member of the Science and Medical Advisory Board. Just what do you see Calroy doing in this industry?
Well, first, Calroy's been an exemplar, I think, in research and innovation both. So, going back, we've talked about some of the studies that have been done previously, but I appreciate the fact that you're asking that question. We're not going to rest on the laurels and say, Calroy has a couple of these studies. We're going to continue to innovate, continue to generate evidence, which we need in this field. We need more of it. So I think we've talked about a couple possibilities for Vasconox. It could be something with females and see, do we have the same kind of some of the same types of benefits? Potentially a shorter term effect. So I think it's really clinically relevant that this was over the longer term. So it's not the 1 hour. with some of the other options. So, but it would be neat to see if, does this have the same kind of short-term effects too? So that's another thing, maybe targeted populations by age, some other types of situations like that we could, look at, which would be nice.
Right.
But, Calroy has a number of products. I mean, I think, there's been some discussion of doing a study with True Diagnostic, which shows these really fascinating epigenetic changes, whether that's with Arterosil or maybe, with Vasconox or any of the Calroy products. I mean, that's going to be really interesting as we learn more and more with that. There's a new product coming with that acts on the intestinal glycocalyx. So seeing how does that, help digestive function, that whole realm, which is another big problem. So there's a number of different directions. And I appreciate the fact that you'll continue to pursue that at Calroy.
Well, I appreciate the fact that you participate in it because it is important for us, to make sure that patients and clinicians feel that when they purchase a Calroy product, they have science that stands behind it. So thank you for your leadership and advocacy. So before we close, clinicians can access the full protocol, which Dr. Spar put together, and deeper educational material, exclusive Longevity Fest offers on the Calroy page of our Innovations and Clinical Implementation home site. And if you're listening here at the conference, the Calroy team is available at booth 7021 for a hands-on discussion about Vasconox HP and nitric oxide. To close us out, if you had to leave clinicians with one actionable takeaway from our conversation today, what would either one of you say?
Do you want to go first?
Why don't you go first? I don't get a chance to think about that.
One actionable takeaway. One actionable takeaway would be there are a lot of people talking about nitric oxide and how to support that. And I would say ask for the data because it's not reasonable to expect patients to be taking something multiple times a day. They're just not going to do it.
Yeah. Even we don't do it.
Even
right?
we don't do it. Exactly. Yeah. So, there are others out there. Nitric oxide is really important. It's not just trendy for no reason. It actually does have legitimate uses for blood flow that's important for so many aspects of our health. Plus, it has all these other effects and receptors all over the body. It's like a signaling molecule. And so it is important to look at it, but let's look at the data of what will help your patients support that throughout the day without having to take something every few hours.
Sure.
I would say, I know in our space, many are doing this, but to continue to think upstream. We talked about how far upstream can you go. In this instance, you're going to get all the other manifold health benefits out of that. And then I'd say demand that the products that you recommend to patients and consume have finished product research, clinical trials on the actual product itself and not just white papers. So I think that's a
huge,
very important.
So critical for our industry. So thank you for joining us. This episode and all future sessions will be available on demand for practitioners. Thank you.
Thank you, Andie.
Thanks.
All right.
All right.
Way to go.
Nice job.
All right.